Manitoba health officials give the public their first look at a COVID-19 vaccine schedule, showing you just when you might be able to get your shots. The next stage of rollout could start in April. It prioritizes a new set of healthcare workers, people who live and work in congregate settings, and the general public over the age of 80. And age, the biggest determinant of where you'll be in line.
There's no approach that's going to capture Manitobans in a perfect order about their risks of having severe outcomes. But what we've done is we've looked at the research studies that exist, and they've consistently shown that the age-based approach captures the best proportion.
People who are immunocompromised will not see priority treatment.
There are studies that have been done that analyzed what approach captures the best picture of the people with severe outcomes, and they very clearly showed us that when you do an age-based approach, not only do you capture people based on their age alone, but you capture most of the people with those health conditions that lead to the severe outcomes as well.
Also left off today's list, essential workers.
No decisions have been made about whether or not essential workers will be included, nor if they are, which categories of workers would be included.
As for the rest of the population, well, that depends on who you listen to.
We are extremely confident we will be able to have everyone vaccinated who wants it in Canada by September 2021.
But Manitoba's projections don't align. In a low supply scenario, Manitobans at the end of the list would get their second doses by December. If the province gets 700,000 doses of yet to be approved vaccines, it could wrap up vaccinations by the end of August. The vaccines we do have are not yet approved for children and teens under 16. If that changes, the province says they'll go to the end of the list. The province aims to open vaccination super sites in the southern and Interlake Eastern regions March 1st. It'll then fashion similar pop-up sites throughout the province. Of course, this all depends on vaccine supply. The province says if it doesn't get another shipment of Pfizer, it will run out by February 7th. More information on First Nation vaccine rollout will come in the coming days. In Winnipeg, Stephanie Lasuc, City News.